Hello, welcome to our Tuesday talk. Hope everybody had a nice Labor Day weekend. It's obviously a very exciting time of year with the start of the football season and whatnot. We're going to continue about what we had in our last Tuesday talk, which we talked about patients who have lost weight for a variety of reasons. And what we're going to focus on today is the belly or tummy. Okay, we discuss why exercising alone is not going to tighten up loose skin. So we're now to the point where we know we have to remove skin. Okay. And we're just talking about skin removal and tightening the muscles. That's what a tummy tuck does, okay? Muscles which can separate because of pregnancy. Some people are born like that. But those muscles after pregnancy don't come back in the middle. And part of what a tummy tuck does is tightened up. So you get that with all tummy tucks. Where we have variations from the tummy tucks is how long of an incision do we make? And why do we make an incision of a certain length, okay? Part of that is dependent on patient's anatomy, and the other part is dependent on patient's desire. Just because you can do something, it may not be something the patient wants to have done or doesn't want the additional scar to achieve that goal. So everybody, of course, is very different. Okay, so what are the different versions of tummy tucks that we perform? Well, the smallest version is called a mini tummy tuck. That's a small incision. It's about the size of a C-section scar, and it just takes care of a little bit of extra skin in the front of the belly. Okay. That can be combined with liposuction, and so can any of the forms of tummy tuck. A standard tummy tuck is more kind of hip bone to hip bone. Okay, again, it just takes care of skin on the front. Then we do what we refer to as an extended tummy tuck. It goes more towards the side. Okay, if you're laying down almost to where your back would touch the table, somewhere around there. That's an extended tummy tuck, and that's done when you have more looseness skin that travels further. If you're sitting down and you can see skin overhanging and it doesn't stop in the middle but it goes to the side, that's somebody who might need an extended tummy tuck. And then there's all different words or ways to describe what we refer to here in Savannah as an around the world. Some people call it a belt lipectomy. Some people call it a lower body lift. And that's an incision that goes all the way around from front to back. Now, what does that do differently than the other surgeries? Well, in the front, the surgeries look about the same. Where you start to see the differences on the side. If you have loose skin and you can pull on that loose skin and you can see your outer thigh lifts, and you can pull on the skin in the back and you can see your buttocks lift, that's what you're going to get from around the world. Now, obviously, if you don't have loose skin there, there's no reason to make the incision to go all the way around to the back. And if it doesn't bother you and you realize what the limitations are, again, you don't necessarily have to do that, because in the front, the around the world doesn't look any different than an extended tummy tuck or a regular tummy tuck. So the biggest thing to know with when choosing the type of tummy tuck is what are the similarities, what are the differences. And the similarities are that you're going to get tightening of the skin in the front with all those surgeries. You're going to get tightening of muscles in the front. You can do liposuction with any one of these surgeries as well. Okay, the longer the incision, the more skin you start to remove going towards the side, and the around the world allows you to remove the most amount of skin all the way around, and it will give you some lifting of the outer thigh and lifting of the buttocks. And if that's something that you desire or have loose skin in that area, then that may be the best option. Of course, the only way to tell for sure is to have an in-person consultation to go over your options. Thank you.